Good afternoon. I'm Tony Avery. I'm a health administrator at the Durham VA healthcare system. That's in, our main hub is on 508 Fulton Street, across from Duke University Hospital in Durham, North Carolina. We service roughly 27 counties of veterans, going far out east at Cataract County. I'm still new to the area, so I moved down here about 4 years ago with my family in Knightdale. Just up the road, so they're expecting a boom too, and I don't know if it's as extensive as going on in Garner, but I see some of the development happening there as well. My background is in about 15 years in healthcare under the VA. I started in New York at the Hudson Valley, which is primary in mental health, but we also did some specialty in primary care. Moved down here and started in our executive suite, and now transitioned over with our ambulatory care, primary care services, and my newest project will be here in Garner, kind of getting the Wake OPC outpatient center off the ground. And as you can see, it's moving pretty quickly. We expect that to be finished in early FY25 completion and activated and seeing patients close to April or so that year. So just wanted to cover everything a little quickly. So
awesome. No, thanks for being here. Kanat? Yeah. Good afternoon.
Hey, good afternoon, everyone. Kanat Tramviet. I'm a system director for our strategic planning team at UNC Health. I'm an undergrad UNC and grad UNC as well, so if there's any Tar Heelers in here.
Go Heels.
Yeah, exactly, right? We're blood by nature, right off the bat right there. But I've actually did my undergrad and grad here at Carolina, and then worked at Duke for a number of years, and then had a quarter-life crisis, and actually moved to California and decided to do healthcare over there for the past 9-10 years. It's shown me a lot of what, in a progressive state, what all the technologies and innovation that's happening. And so coming back here, I've only been in my role right now for 11 months, but obviously I'm very proud to be a Tar Heel and also working at UNC Health. As many of you know, that we have some presence here with our urgent cares, pediatric care, surgical care, surgical clinics, and even OB as well. And as we develop our network to serve all North Carolinians, one of the things that we're always looking at is our partnership currently with UNC Rex, that's in Raleigh, but also UNC Johnston, which is in Smithfield, and Clayton, which is literally nearby here, obviously. And how do we make sure that we serve our patients in Garner as well? So we're continuously looking for opportunities to grow and serve the population. One thing that as the panelists, I'm sure will agree with me, it's really challenging sometimes, right, as population grows, but sometimes you have situations where your medical professions are not growing at the same rate. And so how do we make sure that we have the right care at the right setting and also at the right communities, right, to be able to provide as comprehensive of a care as possible? That's something we're constantly looking at. So, welcome any thoughts as we kind of go through the panel today. But thank you so much for having me.
Awesome. Thanks, Kanat. Rick? Yeah, good afternoon.
Great to be here. Thanks for asking. Rick Schrum, Chief Strategy Officer for WakeMed Health and Hospitals. Been in the healthcare arena for a number of years and been at WakeMed now for about 7-ish years. Matthew said early that we could go off script. He probably shouldn't have said that.
Did I say that?
To me. So I really wanted to take just a second to recognize somebody in the audience that is a true treasure to our community and a true treasure to WakeMed. Sonia Barnes. Sonia, would you stand up, please? Sonia is one of our great leaders in this community, and she's on the board of directors at WakeMed Health and Hospitals. So thank you, Sonda. Please join me in thanking her. I love to do that. She's one of my favorite people in the whole world. And I get to embarrass, board members in front of a lot of people, make them stand up and wave. What are we doing here in Garner? Well, first of all, WakeMed has been taking care of this community for a long, long time. And we've been committed to this community forever. We've got our healthplex here that's one of the busiest in the state of North Carolina. Most people don't realize this, but collectively, WakeMed's emergency departments are the 9th busiest ERs in the country. And our healthplex here is definitely one of them, probably more busy than most 350-bed hospitals. So we have that and have had that for years here. We have urgent care. We have, our physician practices and all kinds of commitment that we've made already to the community. And then we'll talk in a little while. You saw a little bit about what we're going to be doing at White Oak, and I'll expand on that in a little while too. So we've got some great future plans here in Garner.
Well, while you brought it up, you went ahead and brought it up. So why don't you talk about that a little bit? I think we kind of want to know, one, why everyone here is expanding and doing more things here in Garner, and what do you see as the opportunities to move forward? So if you go ahead and talk about the White Oak project, it'd be great.
Sure. For us, it's about serving our community, and Wake Med was founded and holds very dear to its heart that we are here to serve everyone and to enhance the well-being of our greater community in a way that serves everyone. So we believe that we can carry on our mission by coming to Garner and making this large commitment in White Oak. But it's honestly, it's more about the long-standing relationship that we've had with your community, and what a great supporter and advocate this community has been for Wake Med. What we're going to be doing is really something pretty inspiring. We're developing a whole health campus in White Oak. This is only the second one that I'm aware of in the country. There's one down in Austin, Texas, but basically it's recognizing the interplay between medical health and mental health. And it's one of the things that I come to the table with is about 25 years experience in the mental health and substance use arena. There is no health without mental health. It's not possible. So what we're trying to do is to develop an integrated model of care that is new, different, and really what we see to be some of the future moving forward. So we'll be building a 45-bed acute care hospital to start, and that will have all the normal kinds of things in it. Our ED will be moving from the Healthplex, where it currently is, to the new hospital, and then we'll put all the fixings around it. Inpatient beds, CAT scanners, MRIs, labs, laboratories, all that stuff. On that same campus will be a 150-bed behavioral health hospital, which will be probably one of the biggest, in the state of North Carolina once it's complete. So we're really excited about, this project. It's a 53-acre project, over $400 million in CapEx to bring it out of the ground. At scale, once we get everything open, we're probably looking at 500 to 600 FTEs, which is maybe 1,000 or so people working on that campus, and an annual salary collectively of probably over $50 million. So jobs that on average are going to be $100,000-ish for the community. So it's quite a big commitment that Wake Med's making.
Is there a timeline on starting, or
No, not at all.
Come on.
Yeah. Well, some of
what everybody wanted to know.
As you guys know, and you see all this stuff, jumping out of the ground here, some of that's a little bit unfair. We are going through an RFP development process right now. We hope to release that RFP probably in September. Then we will, once we make a selection, we'll go through design work and figure out that whole health campus concept in a deep way. Hopefully break dirt sometime in 24 and be out of the ground last quarter 26, early 27.
Great. Good. I wrote those days down, so I'm going to hold you to
I
those.
see you over there.
Yeah.
But supply chain contracts, contractors.
These things take
moving
time,
target.
especially something that
Moving
big.
target.
Yeah. So, for UNC Health, I mean, you guys have expanded the pediatrics here. What do you see as the opportunity here in Garner?
Yeah, it's really interesting, right? They purposely sandwiched me because these guys have already started building stuff or has decided to do it. But one of the things that the three of us were just talking about, and this is something I haven't, fully vetted with leadership or anything like that, but one of the slogans that I always like to use is we want to complete and not compete. Right? And I think for towns like Gardner and these very small knit communities that really are strong, we need to make sure that all of us are working together. And that's something that I've talked to my leadership about. How do we partner with them? So as they develop their programs in HealthPlex and they develop a VA program, how do we create rotating medical students to the VA to have a better, more robust clinical care in Gardner? These are things I think we need to continuously talk about. Again, new guy on the block, so I'm going to still use that card, right? New kid on the block. But I have heard that, we've discussed about some ambulatory surgery centers and things like that. And, I think one of our biggest challenges is that as a health system, we have several $billion that we've potentially infused capital in terms of building across all of North Carolina. However, with the construction costs and supply chain issues, we're also having the same issues of where and when these timings occur. So as we're going through that, I think one of the biggest important pieces is watching our partners here and watching what they're going to develop. And again, making sure that we're not competing, but making sure that we have complementary services because that's more important, I think, to a community like this than to be competing for services. So that's something that we're continuously looking at.
Yeah, cooperation is always better. We talk with like the Clayton Chamber, like we're not competing for life sciences stuff. We want to, expand that 70 corridor to actually, kind of work together on things. So, Tony, why are you guys here? I mean, I'm curious how that decision happened. It was a little before my time here, so.
So the VA here, obviously the VA is the largest healthcare system in the United States. They're in every state, they're in every nook and cranny, and that's what they specialize in, is actually bringing the care to the veterans. So here in actual Wake County, we have a little bit north of 26,000 veterans, and we have about a high 60% penetration rate. So we haven't touched all the veterans, and how we kind of justify our growth to Congress, who is one of our many bosses, is that we're continuously are reaching our patients and our veterans out in the community. So one thing that we're doing here in Garner is we're consolidating some of our smaller clinics that we have in the area that are outgrowing themselves. We have 3. We have a Raleigh 1, 2, and 3. We're not really creative with the names, but we're going to. There are 2 of them are they're mixed use clinic, right? So they're mixed use where 2 of those clinics are primary care and 1 is a mental health clinic. So we're going to consolidate them and bring them into the Garner. We will still have outpatient clinics, new ones, and of a new model where you kind of see in your primary care probably now is on stage, off stage. We have a new one that just opened in Crosdale up in Durham. So a new clinic that's 24,000 square feet. So our clinic here will be a hub, what we call a healthcare. Again, we're not really creative with our name. So this will be Wake County OPC. So it'll be, it used to be a healthcare center, but now is outpatient center. So it will have 26 PAC teams, and a PAC team is a primary care team, a coordination where we basically have a social worker, administrative person, the medical physician, and just a whole care team that attends to a veteran. So with 26 PAC teams or so, 20-ish, we'll see up to 30,000 veterans in the area. So that will cover Wake County, Johnson County, a little bit of Chatham, I believe, is on the side, and then all the way up to Durham. You don't want to go, another thing that we kind of get held to is wait times for our care. So you probably hear about the Mission Act and now the PAC Act. With the Mission Act, it was saying that, I just want to give the synopsis of what the actual act is. A lot of these bills are about 800 pages long. But what that offered was veterans to get care in the community if they weren't able to reach one of their VA centers, a primary care physician or a specialty physician within a certain amount of time. For primary care, it's 20 days. So we try to hold our wait times under 20 days for a new patient, and we do a really outstanding job in Durham healthcare system, especially west of 95. We have 2 facilities that's east of 95, our Greenville and our Morehead City. But here in Raleigh's, we actually see them. 2 of our clinics are less than 10 days. So one of our physicians will be able to meet with a veteran and start their primary care with them less than 10 days or so. We want to keep that trend going, so we want to put the care where it's needed. And we see the growth here. We had an opportunity to build here, and that's what, kind of what we're doing in the community. So I know you brought up that, Rick brought up the FTEs. We'll be bringing a just of north of 500 jobs will be here. Some of our, I would say a net new will be about around 400. Some of those staff will be from those 3 consolidated clinics, and then we'll be hiring up in that area. So.
Yeah, so well, you're talking about jobs, right, and hiring. So how is, obviously we're kind of getting out. I've talked to some healthcare, system providers, and they've had a real challenge, right, a real struggle in hiring not only construction teams to do things, but also just, primary care physicians, workers in the hospital, cleaning crews, and those kind of things. What have you guys seen in that as we kind of move forward?
Yeah, that's an interesting question for the VA, because one of our missions is the training aspect, and you heard about the partnerships, and we have partnerships with all the community teams that's here. I would say Duke, UNC, even Wake Med. We have our relationships with them. So a lot of our providers is a little bit easier for us to hire sometimes. Some of the stuff that we offer, better outpatient hours, a little bit more support for our providers. So this side of east of or west of 95, that's how we kind of break it down so we know where we're at as far as internal. We actually do well with hiring now. Some of our providers, a little bit of a struggle during COVID times, coming out of COVID because of what was mentioned earlier, just harder to bring people back. A lot of people went home. So the support teams, the administrative teams, a little bit harder as we see patients face to face. To give good quality care, you have to see the patient at some point. We do offer all sorts of modalities, telehealth, phone visits, but the actual care, at some point, you're going to need to come in and actually touch that veteran and, that patient. So that was a little bit of a hiccup, but we're seeing some growth over the last 6 to 8 months or so, just onboarding a lot of staff faster.
Yeah, well, Kanat, we were talking earlier about telemedicine, telehealth, and how that could help alleviate some of those things. But I know last year at this conference I was speaking to somebody, and they were saying there's also a lot of burnout with the employees that they did have in the health system because you weren't able to hire. So what are you saying in terms of all of this?
I think one of the biggest things is the provider workforce, not only on the physician side, but also on the nursing side, right? So I've got really great friends in the national recruiting firms for physicians and nurses, and I actually, before this today, had a conversation with them, and they said the top 2 recruitments that they get requested across the nation is nurse practitioners and family medicine, right? So whenever you guys see shortages in your own community, that also is probably reflective of across the country as well. And some of it, to what Matthew was saying, could be attributed to burnout, but also we're not producing enough of those given the need of the communities. And so that's something that all of us have to pay attention to. And as an academic organization and pumping out the next generation of clinical providers, we need to make sure we're also strategic, that if we're raising and making sure that we're raising the next generation of physicians, how are we keeping them in North Carolina, right? Instead of letting them go back to maybe wherever they grew up in. And I think that's something that we need to work on a strategy around. And I think we've got some really smart people at UNC that's working on that. But that is something that we do see a shortage. And, for me, as again, coming back 11 months ago, some of the pain points that I've heard was we can't keep a clinic open because we don't have enough nurses to keep it running 5 days a week. Like, to me, that's very sad because that's something that all of you need to have, right, access to. And I'm sure every single one of you in this room can relate to trying to schedule a clinic visit, and it's like 20 days, 40 days, 50 days, 60 days out at times with certain specialties. I mean, those are just unacceptable, right, given the landscape that we're in. However, are there technologies like telehealth, telemedicine that we could leverage in communities like this that perhaps we can't give you every single subspecialty, but what if we can do that via video visits? What if we leverage technology and make sure that we can provide that in your community? And then when you truly need to come to the mothership, because, I'll be the first to admit, I hate parking at the med center. It's probably the most nightmarish place you can drive into because the parking situation is terrible. So if we can keep you away, and I think that's something that all of us probably agree here, but we can talk about healthcare all day long, but at the end of the day, we are the last resort, right? We don't want you coming to us if all possible, right? We want to keep you healthy. And so, having telemedicine, having technologies like that to actually prevent you from coming in if you don't really need to is a critical part of also balancing and complementing, I think, the physician shortages and nurse practitioner shortages we have across the country. So,
Just a show of hands, how many people have used a telehealth or done a telehealth visit? Okay, I assume so, but yeah. Rick?
Yeah, I would echo some of the same thoughts. A bad equation. COVID plus the Great Resignation plus our growth puts us all in a tough spot from a workforce perspective. I think all the businesses are feeling it. I have a friend that runs a large health system in Atlanta. It's called Piedmont Health, and their pre-pandemic monthly spend on contract labor was $4 to $5 million a month. Okay, a lot of money. 20 hospitals. At the peak, when I was talking to him of some of the workforce challenges, $45 million a month. So we're not in that bad a shape. But directionally, all health systems feel this, have felt this, and I'm sure other businesses. We have for a long time, partner with a lot of educators in the state, including UNC, Duke, NC State, all of them. One of our key partnerships, though, is with Wake Tech. And Wake Tech partners with Wake Med in big ways to create programs in areas where we need workforce. And so we basically provide the curriculum and a lot of the instructors, and they put the program together and execute. And so we've had great success there. We're seeing things change at Wake Med in a fairly large way with our workforce. Every Monday we have a new employee orientation, and we're setting records, the number of folks that are in those seats. And it's interesting. It's people from all over the place, to include people that went and did travel contract labor that are coming back home to Wake Med. So we're seeing that begin to turn in the right direction.
Well, so as we look at the future, right? You've got all these things. We've got technology now, which is really available and people are using it as a tool. Kanat and I talked earlier about AI and what that can mean for the health industry, and kind of the future of personalized medicine. Something I find really pretty remarkable, right? So like more personalized, where if I have some disease and somebody here has the same disease, we're going to be treated completely different because of our DNA, right? And you can research that and you can know what those things are. And as we move forward, what are the opportunities for that kind of medicine? But here in Garner, is there anything we can take advantage of economic development wise that we should be like, hey, we should really focus on this as we recruit companies and recruit technologies and look forward? So I'd love to hear what you guys are doing, but also what you feel Garner could do.
Yeah, that's a really great question. I'm kind of peripherally involved, but haven't been fully involved. But we are working with AI and kind of understanding how that can support healthcare systems. I mean, personally, right? And I think you guys can all relate. But would you rather talk to a doctor or to a robot, right? I mean, it gives you that little bit of that anxiety, right? Of how would they know how to take care of me? And so maybe not necessarily using it for clinical care purposes, but maybe creating a pathway so that you know where you could get to, how you could get to appointment, how you can connect to the next provider care that you need. So that's something that we're fully exploring with other companies out there. So that's something that's really exciting, and we look forward to kind of seeing what the outcomes could be. And just going back to, again, Matthew, what you mentioned about what could Garner do, I think these telemedicine and telehealth things, a lot of the conversations are always around building those technology platforms, but how do we get our community to use that a little bit more? I think that's also something that's really critical. So are there businesses or support systems? I mean, I heard, one of your sponsors was senior living, right? How do we partner with those types of entities that are in your community already in that continuum of care? We talk a lot about primary care, and you need a lot of specialty care. But oftentimes we forget the post-acute care side, right? So the senior livings, the long-term care facilities, the behavioral health centers, things of that nature, and how do we leverage technology to do that? I think that's something that has tremendous opportunity for a growing town like Garner. So to me, that's where I think some of the opportunities are.
Rick, yeah.
Yeah, this is one of my favorite spaces. Actually, and I'll answer it a little bit differently, but a lot of the way than the same. The answer's in the data. That's kind of how I think about it. Think about all the data that's collected as you and your family access the healthcare system. We're not leveraging that anywhere near to its capabilities. The federal government a number of years ago had us all move to electronic medical records, and the theory was that all providers would then be connected. And if I went to UNC, and then the next day I went to Wake Med, they would be able to seamlessly see what's going on with me. And that's happening for those of us that are on the same electronic medical record, okay? Give you an example. We have a very large accountable care organization, which is a collection of about 1,200 different physicians, APPs, that do alternative payment model type of contract with insurance companies. Within that group, we've probably got 25 different electronic medical records that aren't connected. So the answer is in the data. I think that a lot of our future in healthcare from the standpoint of new ways to treat and keep people healthy is going to come from the leveraging of that data and getting that all connected, and then put it in ways that it's easily understood. We might call a certain thing a name at Wake Med. These guys in their systems might call it the same thing, something different. So how can you search a data set that is naming things differently, right? So we've got a lot of work to do to really kind of work our way around that. Personalized medicine and AI, we're doing a lot of that work already at Wake Med. We're doing a pilot right now that we're screening patients for suicide risk, where we're able to, the people that come in and say, I'm feeling terrible and I want to kill myself, those aren't the ones we worry about. The ones we worry about are the ones that are quietly suffering. And in that data, in that AI application, we can find a lot of folks that we wouldn't typically find that are really, really struggling. We're also using AI in our intensive care unit applications across the system to include eICU, which we're monitoring patients digitally. So we're looking at that data to be able to predict someone going in the wrong direction quickly. So before they head to the wrong place, our treatment teams can intervene. So we're starting to leverage that really in the beginning stages. AI is getting kind of a varied rap, in our communities, and it should. It's something we need to proceed with caution on because, bad people can do bad things with good things. But AI and the application on what I think we do every day, I think it has great promise, and I'm very hopeful that we get that figured out.
Awesome. Tony, love to hear your thoughts as we kind of close this out on
I'll just
the
give
future.
it real short and just add, because we're doing similar stuff as UNC and Wake Med. I actually just saw a pilot that we're working on under the VA, and this was at Orlando, and it's trickling out to a few VAs, is that they're using the AI headsets for some of their mental health modalities and mental health care. So we do a lot of evidence-based practice therapies for our mental health veterans. So that is good to kind of just put them in a better environment and kind of see where, literally where their headspace is at. Another way it's two ways. So you use it for the end user which are the veterans, and then there's some AI that we use on our side internally for data. So we do a lot of data collection on our side, and it's helped, on our side to make better informed decisions. So data and information, as you can, probably already know, is two different things. You'll get a lot of data, but if you're not interpreting it correctly, you can make a wrong decision. So we use that AI just to help us make informed decisions. It's not, hey, the AI is saying this or the data is saying this. We take that and we kind of crunch it down and analyze it so we can make better clinical decisions. So we do use a lot of data. And just as far as like electronic health records, the VA was probably the first that did it across the nation just because of the way our health system is built up, and that was in the early 90s. We're a little bit behind now because we've grown so big, it's hard to actually upgrade and change that system. However, we do have the Epic Link, and we talk to all of these different healthcare systems in the area, and we kind of have embarrassment of riches here where we have these really outstanding healthcare systems in this one concentrated area. So a lot of times it gives options to veterans. I'll just kind of give my personal experience. I go to Duke and I also go to the VA as a veteran. My information is there. My provider that's here, he sees anything what's going on. If I did some labs at Duke, he gets to look at them and kind of interpret them there. So you kind of get your really quick second opinion, as most people will say. So yeah, data and AI and a lot of technology, all healthcare systems are focused on that. We have a nice research center. We're actually building a cancer center in Durham. So we're focused on sort of what the future of healthcare is looking like in the next 5 to 10 years, because it changes pretty often.
Yeah, well, it's great to have you all here, right, in the Triangle. So it gets back to the quality of life that we talk about and why people are really drawn to this area. I'm excited about the changes. We'll see what happens over the next few years with this, but I'm excited to tour the VA in 2 years and the E-District, Wake Med Hospital, and whatever UNCL is doing as well. So we want to give everybody on the panel here a big round of applause. Thanks for joining us today. Yeah, again, we are appreciative of you all and being here in Garner and what you're doing. So thank you very much for being here.